Now let's hear from some incredible leaders who are going the extra mile. They will share their insights on making CSR investments reach those in need and creating a more equal society for all. With this as a background, may I request the honorable speakers for the session to be on the dais with us. May I first request the chief of the session, Dr. Nirmaljeet Singh Kalsi. Dr. Kalsi is the chairman of the National Council for Vocational Education and Training. Dr. Kalsi has served 38 years in public service, including 7 years in the Ministry of Home Affairs, Government of India. Dr. Kalsi has a great passion and rich experience in policy planning and implementation of technical, vocational and skilling. So are you ready for having a knowledge ride with Dr. Kalsi? Yes. I think the stretch didn't work.
Yes.
I can't hear.
Yes.
Do you guys want to do a second stretch?
Yes. No.
Okay. So who all are ready for the second round of lunch? Please raise your hands. Okay, may I now request Dr. Kanchan Dua, Associate Vice President at ENY, to be on the dais, please. Please welcome her. I now request Mr. Jitendra Kumar, Innovative Access Lead at Takeda Pharmaceutical. Jitendra has worked closely with multiple stakeholders, including the payer and policymakers, to improve diagnostics and access to healthcare. Welcome, Jitendra. May I now request Dr. Virendra Garg for a short brief on futuristic healthcare to begin the session.
Thank you, Tina. First of all, I am thankful to the esteemed guest on the dais and the esteemed audience in the hall. So let me introduce Shri Nirmaljeet Singh Kalsi ji. Kalsi sir is a retired bureaucrat. He is product of IIT and he spent 35 years of his life serving the nation in one of the most challenging geographical region, that is Punjab, during the years of turbulence. And he is not only an excellent administrator, but he is a researcher, he is a teacher, he is a mentor of excellence in every way. So I'm happy, I'm lucky to have him as a mentor for last almost 7 years. Even CBAT, which we are seeing that we have secured 42 patents. So it was Kalsi ji who fine-tuned the framework of CBAT and who guided and mentored us how to formalize the SOPs, how to strategize and which strategies to be followed in CBAT. And now currently he is serving as chairman of the National Council for Vocational Education and Training. So he is one of the most knowledgeable people I have ever met in my life. So you speak about any topic and you will be amazed to hear from Kalsi sir's mouth. And only thing more amazing and of bigger canvas is his library. So if I had privilege, whenever I am with him in his library, sir is sitting on his desktop. So you just mention anything and you will see a folder in sir's desktop and meticulously arranged array of the books, publications, articles, and sometimes I wonder how he had read so many books and so much material. So we are thankful to Kalsi sir. Today his schedule was very tight. Sir agreed to spare some time to be here. So we will hear from Sir's mouth. Shri, Mrs. Kanchan, she is from ENY. We all know her. And as per the reputation of ENY, I met Kanchan today only, but her vision and wisdom is remarkably amazing. So we are looking forward to work with her and her team in near future on the front of affordable health. So we are already working on one project with Team ENY. So Jitendra ji is an old friend. So working on Takeda, he knows the healthcare from industry, pharma, service, and patient perspective inside out. And when discussing with him about the healthcare is always enriching and refreshing. So in a very casual way, he used to share the facts and knowledge. So few people I want to thank in the audience. Dr. Munda Dugal is here. So she is professor in BGI in community medicine, and we are working together along with IIT Ropar. So Dr. Neeraj Kumar, Dr. P.P. Khosla, Dr. Sachin, Dr. Shailesh, and Vipanji and his team, Dr. Mule, Sanjeev ji. So all the people who are working with us, and we welcome you here, and we hope this gathering is not just a gathering, sir. This gathering is a collection of small team units, and we hope today's program aims to bring all the pearls in a single string and to work as a bigger team and diverse team, because affordable healthcare is not a small field and not a single field, it's amalgamation of multiple fields. So people of diverse background are here in the hall. Dr. Kashdeep, I forgot to mention. So team SIBA, Dr. Cheena Malhotra, Dr. Samiti, Dr. Avantika, Dr. Sujata, Sana, and all other बच्चे जिनका मैं नाम नहीं ले पाया, सब लोग. Dr. Harish is away to escort one of our guests, Swami Chaitanyananda ji. So that's all. So I thank you for your presence here, and I will invite Cheena to take this session forward. Invite Kalsi ji for his talk. ठीक है सर.
Dr. Virendra, distinguished speakers on the dais, friends, it's a matter of great privilege for me to attend today's conference, Health Dialogue, Global Health Dialogue 2024. Dr. Virendra has been planning this for a long time, and we wanted to carry a very special message from Chandigarh, C by Chandigarh, to the global world, which I am very happy that has been shared very effectively. So whatever you can see here is part and parcel of a big project which started with a big vision, which Dr. Vrinder had. And this vision took further strength when COVID came. All of us realized that before that we were talking about digital health and telemedicine. And people used to say, हाँ अच्छी टेक्नोलॉजी है, कभी शायद इंडिया में भी आएगी. But the way Dr. Sahab has worked on this project along with ICMR and PGI, and the way so many patents have been brought out. Today you mentioned 32, 42. That's why I let the whatever institutions they call you. And I was just looking at some of the test reports which he shared with me. And I was so happy to see those reports where he really compared the kind of parameters measured by the health kiosk. So I was compelled to think as to this particular area is really very big. If you really look at the size of the healthcare sector, digital health I'm talking about, is right now about $250 billion. And out of this, India has about $60 billion worth of medical technology market. And part of medical technology market is digital technology market. And if I really look at in the next about 8 years' time, this is going to be really big, about $1.2 trillion. $12 billion. $1.2 trillion मतलब almost इंडिया की 1/3, आज की 1/3 इकोनॉमी आ. That's the size which it is going to have. India must capture this market. Right now, our entire medtech market, which we have captured, is about $60 billion. तो 60 से हमने 1200 तक कैसे पहुंचना है, कैसे उसको कैप्चर करना है. So unless we support our own technologies, unless we support the technologies like the one you are seeing here, I don't think India will be able to capture that market. So India will have to become the tech hub. India is already a tech hub. So med tech hub. India is already a medical hub. India is already a technical hub. So for becoming a med tech hub for India is really rather easy. But the problem is that whatever proof of concept you bring in, somebody must own it to deploy it in numbers. So I think this session is extremely important for us, wherein we are discussing the CSR initiative. And what better than multiplying the power of health technology through telekiosks. I was trying to find out as to what kind of CSR initiatives people have taken and what is the most effective of those. And the most effective, obviously, is the telemedicine. digital health and telemedicine. That's the most important. Of course, there are other initiatives like infrastructure development. Again, this goes as part of that also. Then supporting medical research. So you just heard 42 patents have been filed. And ultimately, these patents are going to be used by Indian companies. So many of them can be made available at a very reasonable price or even at zero price. If India wants to take this forward. Similarly, partnering with the NGOs and non-profit bodies. Then community health initiatives, health education and awareness. Again, this kiosk has a lot of potential. I was just looking at the kind of functions the kiosk is able to perform. And I was amazed that initially they started with
continuous ongoing process. So I know the workforce.
बैचिंग चल रही ट्रिगर ऑन कर
We have been, discussing this amazing initiative of health nation to a very large extent, but people have to be trained to. I feel relatively unexplored. I'll again take example from compared to European nations or US or countries in the West. We have huge data. What we need to do is bring that data together. We're talking about artificial intelligence. But like Dr. Garg mentioned, the need for artificial intelligence is provision of the right data, because that is what is going to be used to bring together artificial intelligence, or that is something that is going to impact the outcome of artificial intelligence. So it has to be brought together in the right way. So I think there's a need for funding for implementation of geographical information, system, mapping of diseases. Again, taking example of COVID, I think that's when we saw, disease surveillance activities coming together. There were reports that were being published on a daily basis. We used to get that one report which mentioned how many beds are available, how many patients are admitted, how many patients are undergoing treatment. That should be a continuous process. We managed brilliantly to do it during COVID, but what we need to do is that the same process has to be in continuity, and at large, the disease surveillance has to be strengthened so that we get a first-hand, information on what the exact situation is, how is it impacting the population, what are the signs and symptoms, how the disease is progressing. I think the need for real-term monitoring will definitely impact the disease outcome, but it will also help us in strengthening our preventive health care. So I think that is one area that that should be strengthened as part of CSR. And last but not the least, mental health. Psychological health and mental health is, I think that is something that we as a country need to strengthen. There are so many patients that I've seen who are in need of psychiatric care. But when even in metro cities like Delhi, how many facilities do we have who admit patients who need psychological care? Very few, very few. There are hospitals like RML who have amazing psychiatry department, but then staying in a government hospital is not very easy, and they have a limited bed strength also. So I think that is something that we really need to work on, because mental health illnesses, they are impacting people in a great way, especially after COVID. I think the number of mental health cases have risen tremendously, and I think a very important area that needs to be worked upon is education of people, awareness of people. People don't know about the impact mental illnesses can have on them. They don't know that they are suffering from a mental illness. There is a social stigma that is still attached to, anxiety and depression, and we don't realize the harm that it can cause to the patient who's suffering from mental illness. So I think not only about increasing the awareness, but the access also. That is an area that really needs lot of strengthening, and of course lot of funds. So I think this is a very important area that organizations should consider as part of their CSR initiatives. So this was a brief picture from my end. I again would like to congratulate Dr. Garg for this amazing initiative, and I would also like to thank all the previous speakers, because the sessions in the first half of the day, they were truly inspiring. Thank you so much.
Thank you, Kanchan. It was really Gagar mein Sagar. She almost touched every topic, and as well as when I was watching the PPT and I was hearing Kanchan, it was like it is the concluding address of the whole day conclave. So she wonderfully summarized each and everything, nitty-gritty of the healthcare from COVID to mental health. So it's a spectrum, everything is connected to another, and this was worth hearing, and very insightful presentation and talk by Kanchan. So अभी मैं टीम सीवाइट की तरफ से हार्दिक धन्यवाद करता हूँ स्वामी श्री चैतन्यानंद जी महाराज का. स्वामी जी इंटरनेशनली रिनाउंड फिगर है, और मैं तो ये कहूँगा कि वो आज के युग के स्वामी विवेकानंद हैं. तो स्वामी विवेकानंद जी से इंस्पायर होके राष्ट्र सेवा में उन्होंने अपना इंटरनेशनल करियर जो है वो छोड़ के जो धर्म ध्वजा पकड़ी, और उसके लिए वो एक हमारे लिए एक जीवित उदाहरण है हम सबके लिए. सो उसके लिए मैं इनवाइट करूँगा डॉक्टर अवंतिका बातिश को कि वो डिटेल में स्वामी जी का परिचय हमारी ऑडियंस से करवाए. डॉक्टर अवंतिका बातिश.
Namaskar Swamiji, and good afternoon everyone. Sri Swami Chaitanyananda Saraswati is a monk of Santana Vedic tradition of Arsha Vidya order, Shankara lineage, a senior disciple of Puja Shri Swami Dayanand Saraswati Ji of Arsha Vidya, under whose tutelage for more than 12 years, Swamiji had studied the Rashtra Natya of Shastras, 3 canonical texts of Indian knowledge system. Having epistemic authority, especially of the Vedanta schools, namely the Upanishads, the Brahma Sutras, and Bhagavad Gita. Sri Swami is a noted professor, author, orator, educationist, and exponent of quantum consciousness. More than decades ago, he has joined the Dakshin Manya Sri Sharda Peetham, Sringeri, and dedicated his life at the lotus feet of His Holiness Jagat Guru Shankaracharya Shri Bharati Peeth Mahaswamiji, the ruling pontiff of Dakshinamanya Sri Sharda Peetham, Sringeri, and has been ordained to the Seva, being the chairman of Shri Sharda Peetham's International Research Foundation of global repute in New Delhi, India. He is the Distinguished Fellow of the Corporate Governance Institute, USA, Chairman RKB International Foundation, Chairman Asia Pacific Development Initiative, a joint economic forum of 25 Asia Pacific countries. Sri Swamiji is the editor-in-chief of two reputed international research journals, namely Abhinav Prabandhan and the Polity Economy. Sri Swamiji is MBA and PhD from University of Chicago, Booth School of Business. He is also earned the postdoctoral degree D.Lit, as well as has been conferred with 7 honorary D.Lit from different universities in India and abroad. He is also a distinguished fellow of the Institute of Corporate Governance of USA and UK and All Indian Management Association too. He is currently undertaking a Herculean task of extensive research on Indian wisdom for leadership and management, the Bhagavad Gita and classifications of Indian scriptures for modern thoughts and needs. Being an internationally acclaimed writer, he has authored 28 titles and 143 research papers. Corporate governance, human values and modern management, management in the light of the Bhagavad Gita, global trade in the new millennium are some of the titles of his global distinctions. His famous title, Forget Classroom Learning, carries the foreword by the Apple's company founder Steve Jobs. Mr. Barack Obama, US President, referred his book, Transforming Personality, during his election campaign number of times. His book, Transforming Personality, also won one of the best sellers in European and North American market in the year 2007.
May I now request our Honorable Chief Guest, Swamiji, to please come on the stage and address the group.
Om Sadashiva-Samarambham Sankaracharya-Madhyamam Asmadacharya-Paryantam Vande Guru-Paramparam Ajnana-Janna-Vitirtham Vidya-Tirtham Vivekinam Sarvesham Sukadam-Tirtham Bharati-Tirtham Asriya. Honorable Dr. Virendra Garg on the dais and other dignitaries on the dais and off the dais, it's a great honor to be part of this global health dialogue. Though I'm not a specialist in the medical science, but I keep great interest in art and in the medical science and keep on interacting with the different experts in the medical science worldwide. Having been associated in many universities across the globe, it was my privilege and honor to be interacting with the healthcare warriors. Better word to be used, healthcare warriors. And day and night across the globe, the peoples are working and they dedicated their life for the healthcare practices and taking the medical science, the research. Once I was interacting with the University of Texas, Dallas, UTD, one of the best university in the world in the healthcare and the medical science. So we have been discussing an issue that the two World War, 1905 and 1945, these two World War have taken the volume of life, but the side effect of the medicine has taken the 10 times of that life. That's a great concern to be focused upon, which we call iatrogenic diseases. Treating a disease, another disease is cropping up, iatrogenic diseases. We must be very careful, and that while writing my book of the corporate governance, which is one of the textbooks in the world, in the 400 universities, which is a text, I'm carrying a copy to hand over to Dr. Abhinand Garg. One of the copy of the textbook is there. Was the first textbook in the world of the corporate governance, where I have touched upon how the corporate governance takes a lead to look after the healthcare and especially the health awareness arena globally. We care about health when something happens. That's a post-mortem. Like something happens, then we take care of our health. We do not concern about health on a health awareness side. That's a great problem, especially India. The qualitative health in India is in a very poor condition. If you take the the qualitative health is very, very, very poor condition because India is one of the country is an advanced country. I call it still today. It's an advanced country. Do not have a department called the public health department. So we are lacking. We have the Ministry of Health, which take care of health when something happens, but there's no department called public health department. Dr. Ravinder Singh from Indian Institute of Indian Council of Medical Research had drafted a document on how the government can come up with the new ministry for the healthcare ministry, so the public health ministry. So to create a general and mass awareness about healthcare, the document handed over to me. I personally had handed over to the Prime Minister. I don't know what is the fate of that document after that. So keep aside the government responsibility, the people's responsibility, the corporate responsibility is enormous in this sector, because the corporate are the backbone of the economic structure, economic infrastructure of the globally. So the corporate has been integrated in the corporate law and in the form of a corporate governance, the corporate social responsibility, that there should be a corporate social responsibility expenditures that be undertaken by the corporate, but honestly speaking, among the gatherings, that it has become just a formality. We call upon the corporates, and all of you might be from the healthcare sector, the medical science sector. You must care that how the corporate efficaciously can involve in doing the healthcare and health awareness activities globally. Different corporate is taking an organized initiative. Maximum the corporate has made it as just for the namesake contributions. They're keeping their own trust and foundation and siphoning the money. That's a very worrisome condition globally. It's not only India. The siphoning of the money in the name of CSR is a worrisome condition globally. How to prevent that? The public awareness is required for that. People's awareness is required for that. And so the health care awareness program, how we can implement from the school level to the university level, from the very preliminary elementary school level, how we can incorporate the health care awareness program under the CSR scheme. A corporate can take up, every corporate they can come up with a scheme and come up with a different ideas how the health care awareness program be implemented globally. I have seen that some Nordic countries, especially the Scandinavian states, have taken up a great initiative in school levels, university levels, but other countries are lacking, especially the South American countries, African countries, of course, some South Asian countries, we are not very cautious about the health awareness aspects. That how is to be focused on. So that's what today's, I believe the topic is the role of CSR in healthcare. I believe this topic, if I'm correct. So that's how we can involve corporate seriously in these aspects, because in the human civilization, the three important aspects, one is the gross health, subtle health, and human skill. There are three dimensions: gross health, subtle health, and human skill. And the first and foremost is the gross and subtle health. Subtle health is a matter of concern because of the way the gadgets and different technologies has entered in the public life. The technology has as a very ramifications. Technology has a huge ramification. How to do away with the ramification? Because I observe very keenly, because I conducted a study. I've seen there's a disease called screen addiction. Screen addiction disease is a dangerous disease, and the screen addiction is making a major impact in the subtle health, human health. So that's we have to be very careful, do focus how to create a campaign on the subtle health aspect, because subtle health is creating a major impact in the gross health. Because we don't care about subtle health. We don't care about the subtle health because the information is floating around. We are bombarded with information across the globe. Different information, which to accept, which to reject. We do not have the discriminatory power. Discriminative power. We have failed to develop our discriminative power. The modern generation is lacking that power. 27, 28 years I have spent in the United States of America, and now 30 years in India. India, I dedicated my life for the nation, and not for India, the globe, but what I observe, the people are least care about the subtle health, least care about the information acceptance, least care about the information rejections. So what are the information that is useful, what are the information is to be rejected? Some modality, some modalities, the healthcare warrior has to come out with some modality. We must care about that, how we must care about the subtle health, which is the mental health you call about, but I call the subtle health because the mental health has a limited parameters. We have the limited parameters, but when we call the subtle health, there's a broad spectrum of parameters. We must care about that. Then comes the gross health. The gross health is a problem of the kind of supplements is available in the market. The kind of supplement, the kind of different Ayurvedic medicines are available, and giving the different types of misleading advertisement of that Ayurvedic medicine is dangerous. Somebody had a month before gave me a medicine for diabetic medicine. I sent the medicine to NABL lab, and I came to know that medicine has a cadmium. That medicine is being sold in the market, open market, is being sold in Amazon and all online platforms that medicine is sold, and it has a very quick remedy for the diabetic patients. But as a result, I am told that it will lead to a serious problem with respect to the internal organs because of the presence of heavy metals. All of you must be knowing how can heavy metal affect all this Ayurvedic medicine. I am giving because Ayurvedic medicine has no control. This country, worldwide, has no control of Ayurvedic medicine. Who is giving approval? Who is controlling the quality? Who is controlling the ingredients quality? You must be knowing the Supreme Court is hell-bent upon that. Hell-bent upon that, and our own fatality, many people are upset about it. I said nothing to be upset about it. Let the things to be seriously, it has to be looked at joke. The public health is not a matter of joke. We are playing with the health, means we are playing with the future of the country. We cannot play with the future of the country in the name of Ayurvedic or traditional medicines. The traditional medicines. So we must be, our whole healthcare warrior must be careful about this type of the new medicines which are entering into the market, which has no control, there's no check and balance of that. And we must be very careful how we use it and what is being used, who are using. We have to be very careful. Rather, a common document is to be prepared on that from the medical fraternity and to come before the appropriate authority to look into that. Ayush ministry is not enough to look into that. I am telling you very carefully. Ayush ministry do not have the appropriate mechanism to check and balance those. This is a very dangerous trend I am observing. The consumption of the supplements, different company, different new company, old company coming out, plenty of supplements, plenty of all the misleading ads, which is worrisome for the new generation. And I feel that in the long term, it will be a tremendous effect in the national health as well as the global health. We first let us concern about our nation, because the other countries, the Western countries, they're very cautious about the way FDA's work. Our GMP is not that way working, not the FSSI. You can buy FSSI certificates just paying money. That's the ridiculous things which I am observing in this country. That FSSI is, you can buy FSSI certificate just merely paying money. So that we must be careful about that. The corporate has to take lead on that, and merely spending money is not enough. The effective way of spending money and the result and the return of investment of money in social care and the social sector has to be looked into. And I call up, and I've told government several times, there should be a regulatory authority who will look into the CSR funding and CSR in being found. Ministry of Corporate Affairs is not well equipped to look into this. Ministry of Corporate Affairs is not enough. Having a CSR certificate and to get funding is not enough. How it is being used, how it is being utilized, maximum portion of money, it must be utilized for the healthcare sector. Let the government should decide that how much quantum money will go for the healthcare sector and other sectors. I think high healthcare should be given the topmost priority. So that's a few words I wanted to share with you. It's my honor that I have been invited to attend this global health dialogue. Though I don't deserve to be here, I am not part of your fraternity. I am from outside fraternity, and now I am into a different style of life. I'm glad that all of you, I could share my views with all of you present here. And Dr. Virendra, once again, my sincere gratitude for inviting me here and the future. And I pray to the Almighty for the future prosperity and happiness for all of you. Thank you.
Thank you so much, Swamiji. And we all feel so blessed to have you with us as a part of the group. This was a complete brain overstorm. Sir, seems like that my brain has just went through a workout. I am sure with this powerful speech, everyone's brain is buzzing with innovative ideas to do more and more for your country. And I think we need a deep breath to sink in all the knowledge that Swamiji has beautifully captured for our understanding. Thank you so much, Swamiji, for being with us, being a part of this global health dialogue. and we all want to thank you again from the bottom of our hearts. Now may I please invite Mr. Jitendra Kumar, Innovative Access Lead at Takeda.
So, when you are at the last in the session, it is very difficult to hold the audience. But after this electrifying session by Swamiji, I feel that I could hold you for next few minutes. So the good news is that I'm not going to take a lot of time of yours. I will try to wrap up as soon as possible. The reason is very simple, because I could see that my fellow panelists has already talked a lot about the CSR, different components of the CSR. Swamiji has already talked about the bitter truth, which I also acknowledge that, which is the fact of the life. When you talk to anyone in terms of the CSR, most of the people will talk to you in the sense of it is more like a checklist for the organization. So today I'm not talking about what my organization is doing about it. I'll be talking very differently. So before I start my discussion, I put my points. I formally want to thank Dr. Garg and his entire team for inviting me in this innovative event, and also to thank him for inviting a very diverse panelist during the course of the day. So a lot of thoughts have come together, which is thought-provoking. So first of all, I wanted to highlight a few of the things. We are talking about the CSR, and we all understand that CSRs are putting some impact, positive impact in the society. CSR has a broader perspective, but today we are talking from the healthcare perspective. And even in the healthcare perspective, we understand that it is a very wide spectrum. So I will not go more in detail about the wider spectrum of the healthcare system, but I will talk about CSR in access to medicines. This is what I feel that it was missed out during most of the discussions, and that is why I thought to bring it up here. The reason I'm saying why it is important. We all know that a lot of funding has been done in the CSR. The first challenge is that everyone is working in isolations. Most of the company, including mine, I will also acknowledge that. Everyone is working in isolation. And that is the reason when you look at the complete patient journey, currently I'm talking about just for the healthcare and in the treatment journey itself. So when we look at this journey, we could see that only bits and pieces are masked by some of the companies. Somebody is taking care of the infrastructure part, somebody is taking care of the awareness part, somebody is taking care of more about the diagnosis part, but majority of the places you find the treatment part is missing. So today, if you are able to establish a big infrastructure, we are able to educate a patient, we are able to do diagnosis, but end of the day, if you are not able to provide the medicine for the patient, so you can think about the situations. So all our efforts has gone in vain. So there is a need of bringing a complete end-to-end solutions, which will help a patient to get the treatment right from the diagnosis to the awareness and to the treatment. And this is not possible by an individual or individual organization. Currently, what I feel that CSR is more about in isolation working. So I will request Dr. Garg, if I don't know whether it is possible or not, but if it is possible to bring a public-private partnership model where most of the companies, they can collaborate their funding at one go, at one place, and decide this is the entire journey of a patient. Here we need about the infrastructure, here we need about the diagnosis, here we need about the awareness, and this is what the medicine which is required. And as a team, we are able to help out this society. So if you are looking forward, definitely as a team, we can explore the possibility of collaborations. I will give you one example why I'm coming to this conclusion, why I'm talking about this. The rare disease. I don't know how many of you know that Government of India or India is among few countries who has introduced rare disease policy. So in the world, if you talk about any of the countries, only few countries has this rare disease policy, and India is among those. So in 2021, Government of India has introduced rare disease policy. although it has some challenges because we do not have the lot of insights. That is the reason government could not build a very comprehensive policy. But I can assure you that it is almost 90% fulfilling their aspirations. It is giving some directions. The only challenge is that government was not very clear how many patients is coming up. And they have launched their portal where the patient was supposed to enroll themselves. So I don't know, how many of you know that how many patients would be enrolled in this portal? Anyone, any guess? So just to give you insights, it is approximately 50 to 1600 patients. So currently the provision for helping these patients is through CSR. Do you know how many patients would have been benefited out of this CSR? Any guesses? So currently no patients. So we know that Dr. Kanchan has talked about the kind of funding which is coming into the CSR. Even after so much of CSR funding, we could not help out these 1500 patients. So this is just one example. Why I'm talking about it, because we are working in isolation. So I just wanted to rephrase that. Can we come together? Can we collaborate to bring a comprehensive solution, which is end-to-end solution for our patients? So this is not about the thoughts. It was just to trigger your thought that there is an opportunity. We should come forward and take a lead towards helping our society, helping our people. And we are very different than the global world. And we should have our own customized solution for our people. So thank you very much.
Thank you so much, Jitendra. This was very short, brief, but very powerful. And it clearly communicates the message that together we can all do better. And there is a need to close the loop working on the entire continuum of care approach. Thank you so much, Jitendra. I now would like to invite Dr. Harish for... Okay, I will hand over the dice to Dr. Virendra.
Now I will request Dr. Harish and Dr. China to present a token of respect to Honorable Swamiji. And now I will invite Dr. Smriti and Dr. Avantika to present. Now I will invite Roxana. Swamiji, India is coming up with a book on our center, the innovation. We have filed 42 books. And Dr. Neeraj to come on the stage. And I will invite Kanchanji and Jitendraji.
To first of all, our distinguished guest of this particular session on the role of CSR fulfilling the unmet healthcare needs, Sri Swami Chaitanyanand Saraswati ji from the RKV Foundation, International Foundation, Dr. Kanchan Dua from E&Y, Shri Jitendra Kumar ji from Tekda, who shared their views about healthcare and uses of corporate social responsibility in our society. Since morning, a comprehensive brainstorming on uses of technologies, the upcoming technologies like AI, ML, data science, etc. has happened to enhance preventive, promotive, diagnostic and curative healthcare services through the futuristic healthcare delivery ecosystem. So in all those discussions, lot of experts, including Dr. V.K. Pal, Dr. Abhay Karandikar, Dr. Rajiv Huja, Dr. K.K. Talwar, Dr. Y.K. Gupta, and lot of other luminaries have participated. So on behalf of the team, I would like to thank all those luminaries who shared their views. I also say thanks to our honorable delegates who are working for the same cause of providing healthcare at affordable price and accessible to everyone in our society. My thanks and applause to all, our team whose members work tirelessly to make this event a success. My thanks are also to all the service providers providing food and all other services of the India Heritage Center. So in the last, I want to thank the God who provided us and our team a courage to have this particular global health dialogue here in the India Heritage Center. Thank you. Thank you.
Thank you, Dr. Harish. And now I would like to request everybody to please join us for the most awaited tea and snacks. Thank you.
Oh.
Very learned.
Vice Chancellor was there, Mr. R.C. Shokti. Once I was there, we addressed one science and spirituality session.
Probably we will like it. Dr. Sailesh and Dr. Risha. They are from the University of Kazakhstan.
I talked about Scandinavian states. I visited Scandinavia. I was in Finland in the invitation of Nokia long back in 2004. Yes. Nokia's vice chairman was my super senior from University of Chicago.
Nokia faced the Scandinavian dilemma of going slow.
But their corporate governance is very important.
She's from PGH. She's public health expert. She's been wonderful. With the
मिलेंगे कभी मिलेंगे रविंदर Dr. Ravinder is very close to me.
He's like an elder brother. He's very good.
Visit once. Please.
He will back by
He spoke to me from Toronto. That's nice. Harmony of life through mental health with the coffee.
इधर से स्वामी Dr. G. She's a activist.
She is also in Chandigarh.
She's Sachin. He is also a classmate and he is looking for medical consulting consulting. He was also in Singapore. He also came back and started his profession.
Thank you, sir.
Thank you.
Dr. Harish
Was there? No need to come in the car.
Guys, hटो गेट ओपन कर ट्रिगर बंद कर दिया ऊपर से फिर पीछे रह फिर पीछे हो जा
blood pressure, and video consultation with the doctor.
Okay, how to do that? You have to stand here.
Or blood test can be done.
Yes.